It's my pleasure to be here today. Just to give you all a little bit of a background of who I am and what I do and why I am here with you all now. I am a full-fledged allopathic Western medicine trained physician. Did my MBBS in India, which would be equivalent to MD here in the US. Did all my licensing exams for United States. Came here. Did my residency at University of Illinois, did my fellowship at University of Colorado and National Jewish Health in Denver. Went on to do about 8.5 years of academic medicine at the University of Mississippi Medical Center in Jackson, where I came up to the rank of Associate Professor of Pediatrics in Medicine. I'm an allergist, immunologist by training, still very much practicing. In Mumbai, though, I went into private practice after Mississippi in Vancouver, Washington. So Midwest, Rockies, Deep South, and then Northeast. It's quite a big journey in 14 years that Hemangi and I did together. And very interestingly, all along, there was one thing that was a tie-in for both of us, and that was our spiritual evolution along with our mental and emotional evolution as individuals and people. And in that, the organization that I was connected with in India before I came here, so since 1995 we've been with this organization. It's called NIRA, which stands for Neo Independent Reiki Alliance. Had been a guiding light for us in our lives, and I'll tell you more about the organization and what they do in just a bit. Coming back to my journey, all along in all these years, even as I was a physician in training and subsequently practicing, there was one thing that was very clear to me, that though I was practicing the very best medicine that was possible in a country that has the latest and the best that the world can offer in the field of medicine, I still felt that my patients and many a times their families were still, as I would say, living on the edge in some ways. Okay, they seemed like they were lost. There were diseases, there were treatments, there was control, there was sometimes remission, but cures were few and far between for diseases that I was treating. Asthma and allergy is my field, and as if any of you all suffer from any of those diseases, those are chronic diseases. They last a lifetime sometimes and can begin very, very early in life. And I realized I was able to give my patients very good control but not cure, and all along that bothered me. And in my own health and in my own journey, I felt that there were things that happened with me that I felt I didn't have the answers that allopathic medicine was providing me. And a simple example for me as a physician, I started getting migraine headaches very early in life and had seen the best neurologists and the best physicians that were there, and all I was told was control. Pop a pill when you start getting a headache and you'll be fine. Now, whether you get side effects from the pills, whether you like the way you feel after you take them, no options. This is what you got to do. Change your diet, don't have this, don't have that. And all along, and this is me since I was a child, I believed if there's a problem, there's a solution. And so I searched and I went into yoga and transcendental meditation, and I went into Reiki, the way the world practices Reiki as a physical healing art. Became a Reiki grandmaster, and still I was not getting the answers. And that's when, along with my medical development, I started going into the spiritual aspect of problems. So figuring out, recognizing, and something now that the Western world also accepts, that many diseases have their origins in the mind. So what shows on the body has its origin in the mind. And interestingly, anything that begins in the mind then influences the body, which then influences the mind. So it becomes a vicious circle after some time. And the most common example of a disease that is becoming the bane of existence, even in a country like India, where the incidence wasn't very high, is depression and anxiety. With regards to the diseases that we are commonly seeing, the connection is something that I realized involves the mind, so the way we think, the way we have our cultural background, our mental processes set in place. Combine that with the fact the way we eat and drink. So the foods that we eat influence our mind then influences our body then influences the choice of foods we consume. The choice of foods we consume again influences the mind, and it becomes a vicious circle. So it became clear to me that it wasn't just a physical disease that I was dealing with. I was dealing with way more than that. I was dealing with an individual who had an entire upbringing, an entire lifestyle set, an entire dietary format that they were following. And at the end of all that, there were diseases or symptoms that were popping up. And what was I doing as a doctor? All I was doing was controlling symptoms. I was never getting to the root of the problem, and this bothered me. This really bothered me as a physician. It bothered me in my own journey. And in the search, I started to realize that I need to look at the root of the problem rather than the fruit that is hanging. That seems like if I break off the bad fruit, the next fruit will come out good. But the reality is the root is rotten. Okay? You're never going to get a healthy fruit. And so I started to scratch my head and prayed to God. I'm a believer in God, and I don't mean to offend anyone's feelings if someone is not, or in whatever higher energy you believe in, that I find the right people in my life who would give me the answers I was looking for. And when I came upon NIRA, which is New Independent Reiki Alliance, and we found the answers to what we were looking for. That's really the easiest way I can say. I truly started to understand what it is that goes on in the human being who we look at as a physical body that is born, that grows, that leads a life, that ages and then dies, and then born again if you believe in rebirth. If not, whatever you believe in, there's a birth, life, aging, death. And I came to realize that there is more to it than just the physical body. So we have 7 layers in our body, as you may or may not have heard of. But to just mention a few that you may have heard of, there's the physical body, the mental body, the emotional or the psychological body, the etheric body, and then the astral body, and beyond all that, what we call the soul, or the universal life force that drives everything that's happening to us. And I realized that if I had to be a good physician, I had to be someone who understands this, who recognizes it, who utilizes all the sciences and arts that bring these together. And when that happens, I realized that many a times the disease that I was trying to treat did not need a physical treatment. It either needed the astral body to be healed, or the etheric body to be healed, or the mental body to be healed, or the psychological or the mind, as you would call it, to be healed. And then in some cases, yes, the physical body also had to be healed. So in this process, when I came across NIRA, the difference between all the other forms of alternative healing that I would have done, and after that, there's been Tai Chi and Qigong and many other things that I've been exposed to, and I respect and adore and admire every single one of them, and each one has its role in the lives of people that need it. I came to the realization that there needs to be an integration of all this in order for a person to truly heal. And that's pretty much what Marianne has done in her journey with us, with starting with physical healing, then going on to mental healing, emotional healing, spiritual healing, which happens through prayer and many other formats, including some of what you will experience if you attend the retreat day after tomorrow. And in that process, the path or the techniques that we utilize, just to give you a little insight into that, helps us understand us as an individual. The problem with most of what I see in modern medicine, for example, is we do these large, what we call randomized placebo-controlled trials with 1,000, 5,000, 25,000 people. But when I take you, or you, or you, or you, or you, you're not one of those 25,000 people. You by yourself are an absolutely, completely, and totally unique creation of this universe, for which no specific trial can ever have all the answers. Coming from the mouth of a subspecialist or super specialist, as they call it in India, then how do you treat people? Well, you do the generic treatments for as long as you want symptom control. But when you really want to get to the root of the problem and heal it, cure it, treat it, we do have to look beyond that. And I think modern medicine accepts that. When nowadays we treat hypertension, we tell people to do meditation, or we tell them to do prayer, or we tell them to do yoga along with it. Physicians are now recommending people to do alternative healing methods for diseases all the way from cancer to simple headaches and common cold.